So this next part, we're going to be talking about the female menstrual cycle, and I'm going to be actually pulling up parts of the endocrine system. Once I find my diagram. Here we are. So yeah, endocrine, woohoo, right? Remember this. So this is the basic breakdown. Oh shoot, this is the wrong one. I need the answers. Just so you can see everything. Okay. Which actually, this worksheet's been really helpful in teaching stuff. So this is the female one. And this is kind of like what we're going to be talking about. So if you have this, I mean, that'll, if at home or something. So basically, normally, you have gonadotropin releasing hormone. This will then go from the hypothalamus to the anterior pituitary. Anterior pituitary will then secrete follicle-stimulating hormone and luteinizing hormone. No, not at the same time. Yeah, typically follicle-stimulating hormone will be produced first, and it'll take some time. And then we'll learn in the menstrual cycle that when day 14 happens, luteinizing hormone will then be released. Luteinizing hormone for a while will be stored in the anterior pituitary until it's released. But yeah, good question. So basically this picture has two different sides of the uterus, but it's just kind of to show you what the two different hormones do. So if you want to kind of think in sequence, this side kind of happens first, and this side happens. But it doesn't happen like here and then here. I mean, it's the same thing. It's the same egg, but I just put on, yeah. So I just put on two different sides. So follicle-stimulating hormone is responsible for ovarian follicle maturation. So a follicle is an egg, and it causes the egg to develop. It also is responsible for another thing, and that is the growth of the granulosa layer. And in the uterus, you have granulosa cells. And this is important because once we grow those granulosa, they're able to produce estrogen and then prepare the uterus. So basically, follicle-stimulating indirectly produces estrogen, but it's just because follicle-stimulating hormone doesn't produce it. It's the granulosa that do. Does that make sense? Yeah. This red around here. Luteinizing hormone, so follicle-stimulating hormone will be maturing the follicles, and then when you ovulate, that's because luteinizing hormone will be released. So while the follicles are maturing, luteinizing hormone is being stored. This is important because luteinizing hormone tells you to release the follicle, okay? And if you're just secreting luteinizing hormone and your follicles are just releasing but they don't mature, then you're never going to get pregnant. So that's why it waits. Luteinizing hormone, so there we go, ovulation. And ovulation is, we talked about your follicle having like two parts, right? You have like the egg white and the egg yolk. And the egg yolk is the one that becomes the baby. The egg white portion of it becomes the corpus luteum. So that's that. So this whole thing is a follicle. But this portion of it that becomes the baby is actually the oocyte. Okay. And then the corpus luteum will then, during the cycle, will become a temporary endocrine gland. So it's temporary. So it'll be alive for a little bit, and then it's going to die. So that's the basic breakdown of everything. I'm going to scroll down. Okay, so on this side, you can see when the luteinizing hormone is produced, it will cause the egg to crack. So if this is the white part of the egg, this is the egg yolk, the egg will crack. So they'll separate. That's ovulation. So you can see the circular part, the corpus luteum, is left behind. It'll stay in the ovary, become a temporary endocrine gland. Corpus luteum will then produce inhibin, progesterone, and estrogen. Inhibin tells your body, and we'll scroll up because it's a negative feedback loop, but you don't need to know that too much. But inhibin will be produced to tell your anterior pituitary gland, okay, stop producing follicle-stimulating hormone. Okay, and the reason why it does this is because you're developing eggs, and your body needs to focus on the one that's produced. So once that separation happens, your corpus luteum says, hey, one egg was produced, stop maturing everything else. Another thing too is when all your energy is on that one egg, you don't get pregnant while you're pregnant. So that's that with inhibin. It inhibits follicle-stimulating hormone. The corpus luteum, CL, produces progesterone. Progesterone, also known as progesterone, period, pain, pregnancy, all those nice things. So progesterone is typically the bloody one. And then estrogen thickens the uterus. So it's pretty straightforward. They both sides pretty much produce estrogen because we are estrogen and we're females. Yeah. So now that there's the basic overview of the hormones, I'm just going, oh gosh, massage day again. And we're just going to go into this. So it's basically the same kind of thing, right? I just have it. See, so this is basically the same diagram, just smaller and in words on this side. And then this portion right here, corpus luteum, with all these arrows. If you see here in the middle. This with C1, 2, 3. It's the same. Oh God, I don't want massage day. It's the same. It's what's happening here. See, 1 arrow, 2 arrow, 3 arrow. So this is the picture, and this is just the words. It's a good little reference sheet. So we're going to start at and when we go through this, at the very top, I'm going to zoom in just to show you how to kind of understand this. You have the follicular phase up here. So the follicular phase has to do with the follicle, because he may ask a question about follicular phase, ovarian, The follicular phase, this top portion of it has to do with the ovaries. This top line, that name, it's telling you, because what's happening is that there's something going on in the ovaries and there's something going on in the uterus at the same time. So they're called two different phases. So there's going to be two different phases happening at the same time.
So menstrual phase is ovarian?
Menstrual phase, what bleeds? Is it the uterus or is it the ovary?
Uterus.
Mm-hmm. Yeah. So the first line up here, the follicular phase, the luteal phase, and the new follicular phase, those three is what's happening in the ovary over time. It's kind of like a timeline. Okay. On the menstrual phase, proliferative phase, secretory phase, and menstrual phase, that happen in the second line, has to do with the uterus. Because while something's going on in the ovary, something is going on in the uterus at the same time. So, and I even put ovarian in parentheses on this side, so you kind of knew it was in the ovary. And then uterine up here to show what's happening in the uterus.
Okay.
So I kind of put that there. So then when you look at, and this is confusing, but I feel like is the best way to do it. So here is all the hormones, all the action. These are just the labels of the phases. This portion right here, I'm going to put in the ovaries. This all happens in the ovaries over time. So this will correlate with the menstrual phase.
Okay, so the top one is hormones.
Mm-hmm. This box narrates what happens in the ovaries.
Okay.
So in the follicular, the luteal, and the new follicular. And then this bottom portion, so this row correlates with this row. So this is the name of it, and this is what's happening in the ovaries. It's a good thing you got those highlighters. Yeah. And then this portion right here, the menstrual phase, this correlates with what's happening in the uterus, which is down here, what I narrated. So typically you'll have the hormone, you'll then have the ovary doing something, and then you're going to have the uterus doing something. It all happens pretty much at the same time, but if you want to think in steps, it happens kind of like in the worksheet. You have your hormone, you have your ovary, you have your uterus, and this is the timeline, but these are the steps that happen per time. Does that make sense? Okay, good. So I'm going to zoom into the first one so we can kind of get a good look at it. So we're going to be talking about the follicular phase, so day 1 to day 14. This is called the follicular phase in the ovary, but it's going to be called the menstrual phase or the proliferative phase, and the proliferative phase in the uterus. Just let me draw a nice uterus on the board. Okay. This is our uterus. And it's not drawn to size at all. So the first thing you're going to have, let's see, is you're going to have the hypothalamus produce, it's tricking me. Yeah. You're going to have your hypothalamus produce gonadotropin releasing hormone. Okay. Your hypothalamus is going to secrete this. It's going to go to the anterior pituitary gland. Your anterior pituitary gland is going to produce 2 hormones, your follicle-stimulating hormone and then luteinizing hormone. I believe in the chart I said. The follicle-stimulating hormone will then go to the ovarian follicles. So this will go to your ovaries, the follicles that are in there. And then the luteinizing hormone is just going to be stored. So it's just going to kind of wait for a little while. It's going to wait to be activated. So while follicle-stimulating hormone is growing these little follicles, your ovaries are also going to develop something called the granulosa layer. So you can see in this portion right here, if I scroll down, this is narrating what's going on in the ovaries. Okay? So in the ovaries, you're going to have ovarian follicles and the granulosa. I couldn't format it well enough. So you're going to have that developing, the granulosa layer. Granulosa cells are going to produce estrogen. Actually, I'm going to do this in blue so we don't get confused. Granulosa cells are then going to produce estrogen. And estrogen is just going to thicken the uterus. And we want that uterus nice and thick because we want to be able to support a baby if we were to have one. So it's just going to get thicker and thicker and thicker while the follicles are maturing. So during this process in the ovaries, multiple follicles are going to develop. The granulosa cells are going to produce estrogen. Estrogen will then affect the uterus. So we're going from hormone to ovary to uterus. You can see in the bottom box, uterine lining thickens and becomes vascularized. And it's becoming vascularized because progesterone we have a little bit inside of us. So it kind of is there, but so it has. Yeah, but there's nothing like specific that affects progesterone just yet. So there's that. So next we're going to go through the proliferative phase. Increased follicle-stimulating hormone will cause follicle maturation and increase in granulosa cells. So we're going to get a little bit more of this going on, a little bit more estrogen, a little bit more thicker. But during this phase, luteinizing hormone is not being produced. It is being produced, but it's just going to be stored. So it's kind of the same thing kind of happening again. But then the proliferative phase, if you look at your top portion, during this phase, one follicle becomes dominant because, right, we want to be pregnant with one baby. So one follicle is going to become the dominant one. It's going to become kind of like an egg. And then the other ones are kind of going to be like, okay, we lost. And they'll kind of like degenerate, but they don't die.
Okay.
You know, they kind of just go away. So that's pretty neat, right? We get one. So one follicle becomes dominant in the ovary, and the rest degenerate. As one follicle matures, the granulosa cells are going to get bigger, and then when the granulosa cells get bigger, you're going to produce more estrogen. More estrogen means a thicker uterus. So you can see in that bottom box there, uterine endometrium thickens. So we're going to go down. All this is happening. One follicle becomes dominant, rest degenerate, one follicle matures, increase the granulosa cells, will then increase estrogen, which will then cause the uterine endometrium to thicken. Now this is where all the action happens. This is known as the luteal phase or the uterine secretory phase. So then suddenly all this luteinizing hormone that we had stored is going to be released. So it's a ton.
So now that luteinizing hormone plays a role.
Yeah, and what does luteinizing hormone do once it goes to the ovary?
Stimulates,
Cracks the egg, also known as
ovulation.
ovulation.
Okay.
So when ovulation happens, the egg will be, like you said, the egg will be cracked. You're going to have this leftover egg white kind of in the ovary, and then the oocyte that was inside of it, right, because we had an egg,
Yes.
it's going to come out. The oocyte that was inside of it is just going to kind of wait inside the tube.
Okay.
So we have luteinizing hormone, see the L. This correlates with the corpus luteum. So this becomes the corpus luteum, which then becomes a temporary endocrine structure. And it's temporary because it's there for a while from ovulation up until the egg dies, and then it degenerates.
Okay.
Yeah, so we have a lot of stuff growing in us and then a lot of dying. Yeah, so lucky us. So in this area, sudden release of the luteinizing hormone, also known as the LH surge. This will cause the egg to crack, pretty much. The corpus luteum is a temporary endocrine organ in the ovary that causes increased progesterone, increased estrogen, and increased inhibin. So the corpus luteum is then going to produce more estrogen. Corpus luteum is then going to produce more progesterone. And then progesterone is what's going to vascularize, because we want good blood flow to go to our baby for nutrients and oxygen. So at this point in time, the body is preparing to be pregnant. It's like, okay, we're going to get pregnant this time. And then you're like, no, you're not. Oh, another thing that too is the corpus luteum tells your follicle stimulating hormone to stop producing. So you can think when you have a lot of luteinizing hormone, you stop producing follicle stimulating. So it kind of.
So it's the luteinizing hormone that it will the other ones if there's too much. Okay.
And the reason why it does this is because we only want to be putting our energy toward one. If we have follicle stimulating hormone, we're going to be producing more follicles. One's going to be maturing. We can't be doing that too much.
Okay.
We can only do one thing at a time. Thankfully, of all the things that we go through, right? So this is fun, okay? So the follicular wall weakens. So the follicular wall is the wall around it. The follicular wall weakens and then it ruptures. So we have stuff rupturing inside of us. That's great. That's ovulation. The oocyte and, yeah.
Oh, you said
Yeah, yeah.
it was ovulation.
The oocyte and some follicular fluid burst into the fallopian tube, so now we have stuff bursting in us. And then this just basically means that when it ruptures and separates and bursts, and it kind of moves into the fallopian tube. This just means it's ready to be fertilized. It's like, hey, I can be a baby. I want to be fertilized. So it's just going to kind of wait for sperm.
Oh, okay. That's where it waits.
Yeah, it waits in the fallopian
That's where
tube.
the sperm has to go all the way up there.
Yep. So they have to
Okay,
sperm.
I think.
Mhm.
So then that's where you said that it would take step by step.
Yeah. So then once it's fertilized, this is your sperm.
Ahead of yourself.
No, you're fine. Once it's fertilized, then the egg will develop and then migrate to the uterus
Okay.
if sperm
Is there-
contacts
is
it.
a different name? Like once it hits different spots? Because I know what, that's an ovocyte or?
Yeah, oocyte.
Oocyte. But then when it hits the oocyte with the sperm, that's a whole different name, right?
I believe it's embryo.
Embryo. Okay.
Yeah, it develops into an embryo.
But is that at the uterus or is that still?
I believe it's at the uterus
Okay.
because an embryo is like, there's a criteria, like it has to be like some amount of cells and then it's an embryo.
Okay.
And then the embryo,
Sure.
yeah, and then the embryo will become a fetus and then carry on from there.
Okay.
So yeah, good question though. So yeah, something bursts out of us, goes into fallopian tube. Oocyte is ready to be fertilized. So oocyte's going to wait.
Okay.
I want to be a baby. What's happening with the corpus luteum, because right, this section is the ovaries, what we're talking about. Is just going to be the remaining follicle, and it's also going to be called the theca interna. So if you get a question of what is the anatomy of a corpus luteum, remaining follicle, it's the remaining portion, it's the egg whites, and it's also the theca interna, which is just some structure.
Okay, so it's not really.
Yeah, if you see it, yeah, theca. And then, but if he asks a question about what is the function of the corpus luteum, it's to produce estrogen and progesterone and inhibin.
Okay.
Yeah. But I highly doubt he'll ask a whole lot about, well, I don't know, you guys might be different, but
Okay.
yeah. So then in the uterus, you're going to have increased vascularization because of progesterone. So that's what I did in red up there. And then you're going to have thickening of the uterine wall because you're going to be producing more estrogen because of the corpus luteum. So next we're going to move into the next phase. Okay, death of the corpus luteum. So the thing is, this egg that's here, so if this egg gets fertilized, okay, like you said, I'm going to do it over here first. If this egg that gets, it ovulates, it ruptures, egg is here, it's ready to be fertilized, sperm swims up here, fertilizes the egg, they come together and then it develops, it's going to migrate, and it's going to implant over here and become a baby. All this vascular, if this happens, this will go into developing the baby. So you won't have a period. So when someone misses their period, it's because there's something they're using it, yeah. But then if this doesn't happen, if there is no fertilization, this egg dies, okay? When this egg dies, the corpus luteum will be like, well, the egg is dead. I don't have a job anymore. So the corpus luteum is going to die. So, right, we have the bursting, we have the rupturing, now we have dying stuff in us. But it gets better. We also have bleeding and pain. So once the corpus luteum dies, the estrogen levels are going to decrease. So the uterus is not going to be as thick. And then what's also there is progesterone is going to stop being produced. Now, progesterone increased vascularization, but if you don't have enough progesterone to support those blood vessels are just going to slough off. And that's when you have a period. So then this is all going to come down. All that effort for nothing. Oh, this is great too. So when the egg dies, corpus luteum knows this. When the corpus luteum dies, that's when your period happens.
Okay.
Okay.
The death of the corpus luteum is your period.
Because you have a decreased estrogen and decreased progesterone. So something else too is when your progesterone decreases, those blood vessels that were pumping your uterus full of stuff because it wanted to have a baby, it's going to constrict. And when it constricts, it's going to cut off blood supply. Now, when you cut off blood supply, you cut off two things, right? You cut off the nutrients, and you cut off the oxygen.
Okay.
All right? So so where do you think like some of the pain comes from? I know you get cramps here, you get cramps in your back, but a lot of the pain comes from the lack of oxygen because the tissues are dying. So no oxygen is going to mean death. And then you're going to have, and that's when you have your period. Because all that blood, because all that tissue, all that blood you have, that's why you have clots, it's because that's the tissue that died. And that's why you have all that pain, is because, like a heart attack is painful because the tissues don't have oxygen. Same thing with your period. When the progesterone stops being secreted, those blood vessels are going to constrict, and once they constrict, it's going to kill the cells, because, I mean, that's how the cells let you know that something's wrong. It's going to kill the cells, you get that crampy feeling, and then you have your period.
So it just cracks, or it just, yeah, it's the blood.
Yeah, it's cool how this all works. And then another thing too, that's really nice. So the corpus luteum produced three of them, right? It produced estrogen, which goes away, progesterone goes away. Corpus luteum also produced inhibin. Now we can't forget about this guy, because once inhibin isn't produced, then follicle stimulating hormone can produce again, and then mature the other follicles, and we can have it all over again. And next month here we come, yeah. So this will increase maturation. So this is why the follicles stop producing, but then they start again, because when the corpus luteum dies, inhibin goes away, follicle stimulating hormone can then go do its thing again.
And now, going back to the days, this is a day, we're looking day 5, 14, and 28 is when you get your period.
Yeah, so the way I like to think about the days, like you said, so day 14 typically happens, so if you had your period like April 1st, then April 14th is when your period, ideally, when your period happens. April 14th is when when you ovulate, and then the 28th is, if it's not fertilized, that's when you have your period. So something I like to think about this is February, okay? Day 14 is Valentine's Day. So I like to think about Valentine's Day, your body is ovulated, and it's ready to produce a baby. However, day 28 in February is like leap year. So on leap year, that's when you have your period, is when it dies, or when the process is done. The egg is only alive for 24 hours, but for the whole process to kind of happen, day 28 is when you just bleed.
So even if you do ovulation and have your egg,
Mm-hmm.
it only lasts 24 hours.
Mm-hmm.
And once the 24 hours hit, if it's not fertilized, then it
Then-
turns into a period.
Yeah, then the egg dies. It takes a while. Then the corpus luteum is like, well, there's no more egg. Corpus luteum dies. When the corpus luteum dies, those hormones levels that you had are going to decrease. So it takes time for that to decrease too. So it takes about 7 days for those to decrease, and that's why some people have PMS symptoms. They have pain before their period. It's like, oh, that's great. It's because your progesterone's decreasing and it's cutting all that off, but it's not yet bleeding.
Okay.
So those levels are going to go down. That takes some time too.
Okay.
But your egg is only alive for 24 hours.
Okay. I didn't know that.
Yeah. So just as a brief little recap, when the corpus luteum degenerates, it's known as the corpus albicans. So when the corpus luteum is alive, it's kind of yellow, and it's alive. But when it degenerates, it becomes a white color. So I like to think of albicans kind of like albino.
Okay.
That's when it dies. However, when the corpus luteum dies, new follicles develop. New egg cells develop. So when there's death, there's life. And then, like I said, in the uterus, there's vasoconstriction. Because there's no oxygen, there's no nutrients, that tissue dies, and then we bleed. Isn't that great? So I'm going to pull this up here so maybe this whole thing can be seen. Yeah, well, I'm going to see if I can hold this correctly. It's kind of weird because I feel like, like in a mirror, it's backwards. Oh, no, this is... You're taking a picture of me taking a picture?
No.